Hey guys, Virginia here from That Bald Chick. Wanted to chat with you for a few minutes about something that's really important to me. As many of you know, I'm affected by a rare skin disorder known as AEC syndrome, which is one of the ectodermal dysplasia syndromes. What many of you may not realize is that the ectodermal dysplasia syndromes can affect the development of teeth, and I've actually worn dentures since I was about 8 years old. I wanted to chat with you about my journey to dental implants. In April, I went to see a physician at the SIU Dental Implant Clinic to determine whether or not I would be a candidate for dental implants. My journey to dental implants actually started when I was about 17, though. At that time, a team of surgeons decided that I needed to have my top jaw broken and moved forward, my bottom jaw reduced, and bone grafted from my right hip into my upper jaw. The rationale for the surgery was to rebuild my upper gum, which had eroded from having worn dentures from the age of 8, and I was having trouble supporting a conventional denture. The point was to rebuild the gum so that it would support the conventional denture and then to get implants. Unfortunately, shortly after I had that surgery, I turned 18 and was no longer covered under my dad's health insurance. I had to get health insurance through my own employer. The health insurance that I got through my employer refused to cover anything related to dental implants. Being 18 and a college student, I didn't have the money to pursue dental implants at the time, so I continued with a conventional denture. Fast forward 20 plus years, and here I am going to SIU to see if I'm a candidate for dental implants. When I went for my first appointment, they took a CT scan and some x-rays and what have you, and then sent me on my way and called me back for a follow-up consultation appointment. When I went in for the follow-up consultation appointment, the physician was looking at the screen that had my CT scan on it and remarked how little facial bone I had. I've been told several times that I have very little facial bone, so I was not surprised by that. What I was surprised by was what he said next, and that is that the bone grafting that I had done when I was 17 had virtually all been resorbed by my body, and it was as if it had never been done, which explains why I'm now currently having trouble supporting a conventional denture. He went on to say that there was nothing that they could do at SIU Dental Implant Clinic to help me, and that I was not a candidate for dental implants. He also said that the longest my upper gum would support a conventional denture in the shape that it is currently in is 15 to 20 years. In 15 years, I'll only be 55. Not wanting that to be the final word, I chatted with some women that I know through the National Foundation for Ectodermal Dysplasia, and it was recommended that I travel to UIC to be evaluated at the implant clinic there. So I was able to get an appointment at UIC with the dean of the implant program. So on July 7th, my husband and I drove to Chicago from St. Louis to meet with this physician. As he stood there looking at my CT scan on the screen, he turned to me and said, "You don't really have a lot of facial bone," which I already knew, of course. He went on to explain that he did not think that I was a candidate for standard dental implants on the upper jaw. There simply was not enough bone there to support them. At which point, I'm virtually in tears. I stood up and waved my hand toward the screen and asked him, "Is this without hope?" He smiled and said, "It's not without hope. It's a challenge, but not without hope. I do need to call in my maxillofacial surgeon. Can you wait just a minute?" Of course, we drove 4.5 hours to be there, so I was going to wait as long as it took. So he went downstairs and got the maxillofacial surgeon and asked him to come up and look at my CT scan. That doctor came up and looked at my CT scan and agreed with Dr. Stanford that I'm not a candidate for standard dental implants on the upper jaw because of the lack of facial bone. He went on to say, though, that there is an option to do zygoma implants. He explained that with zygoma implants, what they do is they sink an implant into the zygoma, which is actually your cheekbone, and that what they would do is put 2 implants in each zygoma, so 2 on each side, and that they would angle one backward like a molar and angle the other one forward like an eye tooth, and then depending on whether or not at the time of surgery they felt there was enough bone in the center of my upper gum, they may be able to sink one standard implant into my gum and solidify it with cadaveric bone or bone in a bottle. Then he went on to say that for the lower jaw, what they would do is remove my 2 permanent teeth that I have and put implants there, and then add 2 more implants and affix a permanent plate there. So in the end, I would have 4, maybe 5 implants on the top, with 2 of them being zygoma implants on each side. So 2 and 2 here. And then 1 standard implant if they could place that one. And then 4 standard implants on the bottom. After he explained all of this, my husband asked, if the insurance doesn't agree to cover this, what kind of price tag are we looking at? At which point the surgeon looked at me and said, an automobile. He said, some people want to ask, are we talking a Toyota or a Lexus? I'm not talking an economy automobile. I'm talking a luxury automobile. Now, most of you know that my son is also affected by AEC syndrome, and he only has 9 permanent teeth on x-ray. So eventually he's going to need dental implants also. So the question becomes, if insurance doesn't cover my dental implants, chances are they won't cover his, then who gets the luxury automobile, right? Right now we're waiting for insurance's decision on the treatment plan that was submitted, and I will update you guys as we go along. I wanted to share this journey with you guys because I know that there are many people out there who have lack of dentition for medical reasons, who struggle with insurance coverage and what have you, and also because I know that there are patients with my own syndrome and the other ectodermal dysplasia syndromes who are looking at dental implants and realize they don't have a lot of bone on the upper jaw to support implants. Wanted to share this with you guys, hopefully to give you hope, and also to keep reminding myself that the doctor did say this is not without hope. I'll check in with you when I have more news. Thanks, guys.